Hello, everyone. Today we are going, or I am going to lecture on Chapter 11. And Chapter 11 has to do with contraception and abortion. This can be a very triggering topic, right? So if you feel yourself triggered, you feel yourself having a bio reaction or something of the sort, make sure you are taking the time just to practice self-care. It may be pausing the video, it may be taking a quick walk, a stretch, calling somebody, or seeing a counselor within the counseling office. These all can be things that can help you through these type of reactions that you might be experiencing. And as always, I invite you to take notes, right? The better you are able to take notes, the writing of notes, the better you're able to retain this information and retrieve it for test taking time. So the main topics have to do with the risk and responsibility, right? The methods of contraception, abortion. If you have my synchronous class, then you have a great understanding because we have had Planned Parenthood come and talk about risk and responsibility. So in the United States, nearly half of the pregnancies each year are unintended pregnancies, right? 42% of these have been terminated by abortion, and abortion can be a controversial topic, right? Whether you are pro choice or not pro choice. So, contraception are condoms, right? Female condoms, birth control is the deliberate prevention of conception or impregnation by any of various drugs, techniques, or devices. So, that's the science term for contraception. And figure one shows percentage of women aged 15 to 49 by contraceptive status. And they did this study from the year 2015 and 2017. So pause the video, take time, take notes, and reflect. Right? And it goes from the male condom to Depo-Provera to postpartum, birth control pills. Who's responsible? Everyone is responsible, right? Because women bear children and have most of the responsibility for raising them, they often have the greater interest in controlling their fertility. But parties are all parties involved are responsible. Society no longer views contraception as being solely the woman's responsibility, not at all. And hopefully, I don't know why they ever did. It's everyone's responsibility. Education appears to instill confidence in both partners to discuss intended family size and contraception methods. So the majority of people perceive gender equality in sexual decision making and responsibility for contraception, right? So men can take contraceptive responsibility by exploring ways of being sexual without intercoursing, right? Helping pay doctor or clinic bills and sharing the cost of pills, injections, and other contraception methods, checking on supplies, helping keep track of his partner's menstrual cycle, and helping her with her part in the birth control routine. In a long term relationship, if no or no more children are planned, having a vasectomy, right? So, pregnancies by intention status 55% intended, 27% wanted it later, and 18% unwanted. Reflect on this, take time. Access to contraception. So, reproductive health care reflects a deep commitment to supporting the family, makes a significant and necessary contribution to humankind, right? When we talk about federal Title 10, Family Planning Program, and Affordable Care Act, or the Obama Health Act, right, provide overlapping services, although some entities have raised religious and moral objections to some provisions, right? Depending on your religion, or religion, different religions in general, their religion variation. Some folks object to abortion. Some people have, you know, um, picketed and have had debates on whether or not Planned Parenthood is something that should be around, right? So reproductive justice, the concept that links reproductive rights with social justice, right? So Planned Parenthood has been the target of, a lot of spirited debates and protests, right? Where people have picketed and marched in front of Planned Parenthood, and you thought Planned Parenthood was all about education and awareness, but they also had abortion clinics, right? So consider factors in a person's ability to have or not have and raise children or not, and questions of equal access and opportunity, right? So these are recommended family planning and related preventative health services, right? From recommended family planning, which is in the dark orange at the top circle, or related health services. And at the bottom is other preventative health services. So take time, pause the video, and reflect. Adolescents and contraception. On average, young people in the U.S. have sexual intercourse for the first time at about age 18. So during the first decade of being sexually active, they may be an increased risk of unintended pregnancies and STIs. So overall, teen pregnancy rate has declined. However, as a result of increased use of contraception, access to and use of contraceptive services often depends on publicly supported family planning centers. Right? So the methods of contraception. Contraception, the deliberate prevention of conception or impregnation by any drug, technique, or device. Right? Condoms, birth control, right? Done in a variety of ways. So the barrier method, which places a physical barrier between the sperm and the egg. Spermicides, which kill the sperm before it gets to the egg. Hormonal methods, which inhibit the release of an oocyte. And intrauterine devices, right? Or our IUDs, which prevent the sperm from fertilizing the egg, right? And we learned all about this if you were present for the Planned Parenthood workshop. So choosing a method in deciding which method is medically appropriate and will be used every time, consider these questions. Do you have any particular preferences or biases? Do you know the advantages and disadvantages of each? How convenient and easy are they to use? Does the method protect against STIs, including HIV? What are the effects of menses? Is it important that your partner be involved in the choice? What other influences might affect your decision? Have you discussed this with your healthcare practitioner? So knowledge and familiarity are strong determinants of contraceptive use. Technology has expanded the ways women can track their periods, locate and access contraceptives, and accept reminders. But it should not replace professional advice, right? Nothing trumps the advice of a doctor, right? Trained doctor. So contraceptive failure, a measure of a woman's probability of becoming pregnant during her use of the method, right? Perfect use, following the exact directions, right? Because some people do not know how to use a condom correctly, right? So rates estimated during clinical trials, the typical use, the way a method is actually used, right? So this table shows the percent of women who will become pregnant over 1 year of use of contraceptives, right? So take time, pause the video, take notes, and reflect from vasectomy to the pill, right, to spermicides, right? So abstinence and withdrawal, also known as pulling out, right? So from a family or planning perspective, the absence of genital contact that could lead to pregnancy. So the oldest and most reliable birth control method of all, withdrawal or coitus interruptus, right? A traditional method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Withdrawal, also known as the pull-out method. This is practiced the world over, but has relatively high failure rate, right? Don't rely on the pull-out method, right? Oral contraceptives, OCs, popularly called the pill, series of pills containing synthetic estrogen and or progesterone that regulate egg production and the menstrual cycle. Okay. Most widely used reversible contraception in the US. It suppresses ovulation 90 to 95% of the time, but in most states must be prescribed by a physician, doctor, or clinic and considered the most effective method when used correctly, but not effective when taken inconsistently. The birth control shot, also known as Depo-Provera or DMTA, injection of the hormone progesterone used to prevent pregnancy for 13 weeks, can lead to irregular bleeding and cessation of periods. So the birth control patch is a thin, beige, plastic, transdermal, reversible method that releases synthetic estrogen and progestin to protect against pregnancy for 1 month duration. Okay, these are the differences. The vaginal ring, commonly birth control ring, A small flexible ring inserted high into the vagina once every 28 days. Birth control implant, also known as Nexplanon, is a thin, flexible plastic rod inserted under the skin of the upper arm that protects against pregnancy for up to 5 years. Right? So this is a demo on how to use the vaginal ring. So like a tampon, a ring can be placed anywhere in the vagina that is comfortable. There is no specific fit or need to check the position of the ring. If it causes pressure, the user may just push it further into the vagina. Right? So barrier methods are the condoms, a thin, soft, flexible sheath of latex, plastic, or lambskin. Some people have allergies connected to latex, so lambskin becomes offered, and if it's over a erect penis, to help prevent semen from being transmitted. So the latex and plastic condoms protect against sexually transmitted infection. Women who are more likely to contract STIs and experience both health consequences can protect themselves from both pregnancy and infection by insisting on condom use, right? More often than not, the woman has to insist on the condom use, right? Where your male partner may be okay with not using it, right? So stealthing, this happens when a man secretly removes his condom during sex despite agreeing to wear one. So don't let someone stealth you, okay? Barrier methods: internal condom, disposable soft loose fitting sheath with a diaphragm like ring at each end. This is to be worn by the female, right, or inserted by the woman. So one ring is sealed shut and used to insert and anchor the condom against the cervix. You have to be a female to use this. Designed to line the inner walls of the vagina and to protect women against sperm. Right. So this is the female condom. Right. It's anchored around the cervix with a flexible ring, much like a diaphragm. Pause, take time, take notes, and reflect. The diaphragm is a shallow dome-shaped cup with a flexible rim that is placed deep inside the vagina. It blocks the cervix to prevent sperm from entering the uterus and fallopian tubes. And if you are a Seinfeld fan, comedian Jerry Seinfeld, his show, there's a funny episode, the diaphragm episode, in which Elaine is buying up these diaphragms because they're going out of stock. Elaine is one of Jerry's best friends. So birth control sponge, a round plastic foam shield about 2 inches in diameter that is filled with spermicide. The cervical cap is a silicone cup-shaped device that is inserted into the vagina and can be worn for up to 48 hours. Spermicide is a substance that is toxic to sperm, right? Naloxone 9, right, is the most common used spermicide in products in the U.S. Preparations are available in a variety of forms: foam, film, cream, jelly, suppositories. So these are all forms of naloxone 9. Considered most effective when used in combination with a barrier method. So you can use spermicide with a condom. We can use spermicide with a female condom. You can use it with a male condom as well. So IUDs or intrauterine devices is a long-acting reversible contraceptive method that is inserted by a doctor into the uterus. You have to be a doctor to insert a IUD, right? It emits either copper or the hormone progestin, both of which are hostile to sperm. Sperm cannot live in these environments. So all types are extremely effective, can remain in place for 3 to 6 years, and can also help reduce menstrual bleeding and cramping. Current evidence does not support the belief that IUD is an abortifacient, right? Abortifacient is a device or substance that causes an abortion, right? This has been a large debate that some people are unaware of, and current evidence does not support the belief that IUD is an abortifacient, right? Okay. This is a external view of IUD, right? And where it goes and how it looks in the vagina or the cervical opening. Pause your video, take time, take notes, reflect. So long-acting reversible contraceptives, right? They provide a highly effective protection against pregnancy and last for several years. They're easy to use. So it includes the IUD and the birth control implant. It's found to be 20 times more effective than birth control pills, the patch, or the ring. The American Congress of Obstetricians and Gynecologists, it urges obstetricians and gynecologists to educate patients about LARC options, right? Or the long-acting reversible contraceptives, right? And how they provide protection, right? So fertility awareness based methods. So fertility awareness based methods and natural family planning are ways to track ovulation in order to prevent pregnancy. This requires a high degree of motivation and self-control, right? So when we talk about FAMS, it tracks signs of fertility, the calendar rhythm method, basal body temperature or BBT method, cervical mucus method, when used together, called the symptothermal method, that can be highly effective, right? So the calendar rhythm or standard days method finds a woman's peak fertile times and safer days for sex from her longest and shortest menstrual cycles. But the basal body temperature method uses slight changes in temperature to determine a woman's ovulation cycle. The cervical mucus method, what this does is determines a woman's stage in the menstrual cycle from the appearance and character of mucus secretions of the cervix, right? Check out figure 8. Figure 8, fertility awareness calendar, right? To use the calendar method or other fertility awareness methods, a woman must keep track of her menstrual cycle. So pause the video and look at it as it pertains from day 1 all the way to day 28, right? Or day 1 to 31, depending on the month and depending on the first day of the next menstrual period versus the possible fertile or unsafe days to have sex. Take time, take notes, reflect. Now we're talking about LAM or lactational amenorrhea method or LAM, right? Highly effective but temporary method of contraception used exclusively by breastfeeding mothers. This relies on lactational infertility in the first 6 months following the birth. If the woman breastfeeds frequently and has not had her first postpartum menses, breastfeeding women may start progestin only methods after delivery. Progestin methods do not typically suppress milk production. So non-hormonal options include condoms, the diaphragm, and the cervical cap. Sterilization involves surgical intervention that makes the reproductive organs incapable of producing or delivering viable gamete, sperm, and sex. So female sterilization or the IUD are the most widely used methods of contraception by married or partnered women worldwide. This could be getting your tubes tied in women or getting a vasectomy for a man. Sterilization is the most common method used among married couples in the United States. Male sterilization is simpler, safer, and cheaper, right? All sterilization procedures are meant to be permanent. So sterilization for women, so female sterilization is now relatively safe, simple, and common. Tubal litigations, familiarity known as tying the tubes, right? Commonly use a mini laparotomy or laparoscopy is a viewing lens is inserted through a small incision in the abdominal wall, and another instrument is used to close the fallopian tubes, usually electrocastration, right? Essure is a non-incisional permanent system that uses small devices to block the fallopian tubes, right? This is a diagram of what female sterilization looks like, and there could be a variety of techniques. So pause the video, read the caption, take time, take notes, reflect. Sterilization for women. So once sterilization has been done, no other method of birth control will ever be necessary. If there is risk of exposure to STI, condoms should be used, but sterilization does not reduce or change a woman's hormone levels. So with sterilization, a woman still has her menstrual periods regularly until whatever age menopause naturally occurs. Sexual enjoyment is not diminished. Right? Sterilization for men is a vasectomy. This is a permanent method of birth control in which each vas deferens is severed, preventing sperm from entering the vas deferens and mixing with seminal fluids to form semen. Takes about a half an hour. recuperation, just a few days, right? So this is the most painless and the cheapest route, right? When you compare men to female sterilization. And I'm surprised more men don't do it. Physician makes a small incision or two to lift, cut, tie, and often cauterize each vas deferens, or in the no incision method, one puncture is made to reach both tubes. Vasectomies are 99.9% effective and sexual enjoyment will not be diminished. Condoms are still needed to prevent other sexually transmitted infections, right? This is what happens when a male sterilization or vasectomy. This is a relatively simple procedure that involves local anesthesia and results in permanent sterilization, right? I know of people that have had it. I myself have had it. Um, it did not hurt that bad, and it's been quite effective. I would highly recommend it. Emergency contraception, or EC. No birth control is 100% effective. Intercourse can occur unexpectedly, and rape is always a possibility, right? So, an emergency contraception, or the morning after pill, or some people call it Plan B, right? It's taken within 120 hours after intercourse. It inhibits ovulation and thickens cervical mucus to prevent sperm from joining the egg, right? So, this is an assumption that sperm has already entered into the vulva, the vagina, and this prevents sperm from joining the egg. Now, it will not terminate an established pregnancy and will not cause a harm to a developing fetus if the woman is already pregnant. So, Plan B, one step, next choice, one dose, progression only. And Ella contains ulipristal acetate. So, you can look that up. You can look up what these chemicals do, right? Abortion or expulsion of the fetus can happen naturally or can be made to happen. Spontaneous abortion or miscarriage is the death of a fetus before it can survive on its own. Physical trauma, problems with conceptives, or problems with the physical conditions within the uterus. About 1/3 of all abortions in the U.S. are spontaneous. So, methods of abortion, and again, practice self-care if you need to. Abortion can be induced in several ways. Early abortion methods differ from late abortions, right? So when we talk about medication, abortion, 2 pills, mifepristone, misoprostol, known in the U.S. as Mifeprex or RU486. This blocks the activity of progesterone, a substance that helps sustain the pregnancy, used to end the early pregnancy, so 77 days or less since a woman's last menstrual period began, right? Figure 11, these are weeks of pregnancy when a woman in the United States have abortions in 2017. So 2/3 of abortions occurred at 8 weeks of pregnancy or earlier, while 88% occurred in the first 12 weeks. So pause the video, take time, take notes, and reflect. Methods of abortion. Surgical methods, the vacuum aspiration or suction abortion, in which the uterus is gently vacuumed, removing the conceptus, the placenta, and endometrial tissue. This is used for nearly all first trimester abortions. But when we talk about dilation and evacuation, or D&E, usually performed during the second trimester and can be performed beyond week 24. This is a vacuum aspiration. You can pause, take notes. Right. Safety of abortion. Abortion performed in the first trimester pose virtually no long-term physical or psychological complications. Single greatest factor influences the safety of abortion is gestational age. Early pregnancy is safe. Amongst all women have some bleeding after the procedure, lasting from several days to several weeks. Transient feelings of loss, sadness, or stress are often replaced with relief and satisfaction. So, women in abortion. Although abortion rates are at the lowest in nearly 50 years, abortion is a common experience among women in the United States. And 3/4 of women cite these motives: inability to afford a child, concern or responsibility for others, having a child will interfere with work, school, or the ability to care for dependents, or did not want to be a single parent, or were having problems with a husband or a partner. Right? This is a number of abortions per 1,000 women aged 15 to 44 by year. Right? So, men in abortion, the ability to rely on their partners for support vastly improves women's post-abortion well-being and adjustment. Pregnancy for males as well as for females can be perceived as a profound right. And after the abortion, many men feel residual guilt, sadness, remorse, and couples may split up. This happens. So many clinics now provide counseling for men as well as women involved in an abortion. The ongoing abortion debate, organizations such as Planned Parenthood have moved away from the pro-life versus pro-choice labels, and newer approach acknowledges the complexity of individual situations and the commitment to the idea of not bringing a child into the world without financial and family support. So these shared objectives, a reduction in the number of abortions performed each year. Constitutional issues like Roe versus Wade, right? States continue to debate how to regulate abortion, and at least have imposed at least one major abortion restriction. So the Affordable Care Act, or Obama Affordable Care, makes sexual and reproductive health care more accessible, right? But the Hyde Amendment of 1977 limits the use of federal funds in abortion-related services. So there continue to be research issues, and those involved that most users of contraception find some drawback to whatever method they choose. The inconvenience, the side effects, the lack of 100% effectiveness all point to the need for more effective and diverse forms. So factors that limit contraceptive research includes high costs, government regulations, social issues, political constraints, marketing priorities, and especially the fear of lawsuits and the effects of extensive government regulation. All right. So we've covered a lot. This has been a very heavy chapter, right? With the risk and responsibility. We also looked at the research issues, and we talked extensively about abortion. There are documentaries on Roe versus Wade, right? There are tons and tons of research that have to do with contraceptive barrier methods, pro-choice, um, and everything that Planned Parenthood has gone through in recent years. So um, again, go back and review your notes early and often. This is how you retain that information, and repetitive reviewing of your notes can oftentimes help you get that short-term memory to go into your long-term memory. Okay, I am Professor Alexander, teaching and